This meeting is being recorded.
Welcome, ladies. Congratulations on being chosen for the long COVID-19 interviews. Can you start off in telling us how you identify?
All right, I'm Black. I live in North Armour Street in Cook County, Chicago. So I'm happy to be here, and I'm happy to share my experiences post-COVID and also listen to other participants as well. So thanks for having me.
Thank you. Can you tell me a little bit about your experience with COVID?
All right, I think I'm gonna start by telling you my COVID story, how I got infected and all that. So I tested positive like 2 months after the beginning of the January lockdown. And I managed to recover. And prior to that, I had a fever, all right? I think it was the symptoms. I didn't recognize that it was COVID. So I was busy just running tests for fever, maybe malaria. I had PT and PCR tests done, and it showed negative, all right? So I was cool, I was like, but the fever kept, it was just getting worse, you know, and I started having difficulties in respiratory difficulty. So we decided to do another test, an X-ray test, and that was when I was diagnosed with COVID-19. And I wasn't used to this kind of experience. It was the first time actually having this sort of disease. So, and I had it, I got it very early. You know, I was like the first person in my family to get it. So it was kind of strange, very strange, not just to me, but to everybody as well. So what the doctor recommended for me was self-isolation in my house. You know, so I self-isolated in my room. I never got to, you know, sit with my family members, you know, talk, eat, discuss, just living life like we used to do. So my food was being delivered to me in my room. You know, I had to, for weeks, even after recovery, I still kind of isolated myself. So it was very, very difficult physically, mentally, and even emotionally as well. So for me, it was kind of inconvenience in having to go through all the medications that the doctor prescribed for me, you know? So it was, I don't know if I should say it was a good or a bad experience, but honestly, to the best of my knowledge, it's an experience I wouldn't wish for anyone. I wouldn't want to go through that again. So it's not a good thing. So I could, maybe if I had more time, I could share maybe recovery, the things I had to do, you know, to recover and all that. So I don't know, maybe I should leave, I should give some time for other participants to share, or if I get the opportunity, you could just let me know, and I'd love to share that as well.
Absolutely. One of the questions, I think you can discuss more about that, but you're speaking a lot about your family, and we want to know how like your family and your friends viewed you at that time, because you said it was a lot emotionally for you, just even in your own solitude, but outside of you, can you talk about that experience?
All right, my family, they were very important. They played a very important role in especially in my recovery, within the period of my treatment down to the recovery. They really helped me, you know. They would go through my medications, you know, even though we couldn't have physical contact. They would go through my medications, make sure I get the drugs I'm supposed to take, and they would make sure I actually take them. And, you know, we live in this condo project on North Armour Street. So sometimes even when they go out, they would call, know how I'm doing, know how I'm faring at home. You know, sometimes I know people who committed suicide, you know, because their family members kind of like not just physically isolated them, they kind of withdrew from them. There was no calls, no texts, and sometimes I don't blame the family members. You know, they don't know how to react to these things. They don't know how to respond to these situations. So some of them just feel they're less informed. So they just think, you know, let's just isolate this guy. This guy should just, you know, and they regret it because at the end, this person goes and sometimes takes drugs and just kills himself or commits suicide. And it's not a good experience. So my family, they were really helpful. You know, they were the first to recognize that this is not a death sentence. This is just a situation that with proper management, proper treatment, we could just get through it. So my family, they really tried. They helped me. They gave me the support I needed. They were like the backbone, you know. They kept telling me, they kept letting me know that this is just something that, you know, I nearly swung into depression several times, you know. I've cried. For me, the feeling I got was like, it was like being HIV positive for me. It was even worse, all right? Because sometimes I would have these cramps in my respiration and I would feel like I would die, all right? So in those times, you know, they would call me, they would video calls, they would see me, they just kind of brought me back to life, if I could put it that way, because sometimes your friends may leave you, but your family, they are always there. You don't choose, you can choose who becomes your friend, all right? But you can't choose who becomes your family. So it's an opportunity I never take for granted. I'm always very proud and honored. I'm blessed to have my family. So my family, 100%, they were there for me. Like I could say they're the reason why I'm here today. So I'm so happy I have them.
Thank you. I love that actually. And then I think in this next question, you can talk about your recovery experience. But I was wondering how even your doctors, what was that experience like with the doctors and being tested and being diagnosed and then the thereafter? Can you share more about that? And then your recovery story as well?
All right, I believe the doctors, they prior to my case, they had already seen other cases of COVID-19, though it wasn't that much, but they had seen some cases already. So they actually were, I think I should say, at least 50 to 70% prepared for this kind of situation. So it wasn't really new for them. They kind of like knew how to handle it. They knew the advice to give me. They knew the recommendations to give me. So after all the drugs and all the medication, they gave me some exercises after the regular medication that was prescribed. You know, they gave me some respiratory exercises. You know, and I would say YouTube kind of helped a lot. You know, I would go online and look up respiratory exercises. You know, there's so many videos. There's so, like, literally anything you want to do on this planet is available online. There's a video on YouTube that can show you how to do anything that you want to do. So I kind of went online as well and tried to see how I can marry what the doctors told me, the recommendations they gave me with what I found online, you know, from health protection health. So I just tried to see how I can bring those things together. And the respiratory exercises, they were not easy, but I tried. I pulled through. I did them. And yoga and meditation helped a lot. You know, I saw it as an opportunity for me to reflect on myself, you know. look at my life, to look at I started to think about the things I've done in the past, things I'm doing right now, and the things I plan to do in the future. How are these things gonna play out in my life? So it was kind of, and though I was in pain, but it was an opportunity for me to kind of reflect on my life and try to recess things, look at things differently, try to see things I could do better. So I would say the whole experience, it had its own advantages and disadvantages. So I just tend to like just try to see how I can put everything together. So I did some, you know, I was confined, all right, within my room for the entire period of the isolation. So I would do stretch walks around. I have this balcony in my room, and I would just walk around there and see how I can just, interact with the environment. Though there was a lockdown, but there's this peace of mind you get when you go out and you look at, it's the first time ever we're seeing the city without people. There's everywhere is just open, and you're kind of experiencing this peace that nature brings, this quietness, this tranquility, and it's just outright beautiful. So I would say the isolation period, it really helped me to appreciate life, to look at life from another perspective. We're always used to this hustle and bustle of town, but this gave me time to relax and see everything clearly. So I really appreciate that. And then I would do some exercises as well. I'm always a very busy person. I walk. There's a shop right down my street. It's a shoe shop. So I work there. So I'm always there. Like I work about 6 to 8 hours a day. So there's really not much time for me to sit down and think about my life personally. So I really got an opportunity to look at that. So I believe that's just it. And thank you for this opportunity to share this. I'm so happy. I never really had an opportunity to share my experiences until now. So thank you so much.
Thank you for being able and up to sharing with us. The next part of it, I want to know, because it seems like you internalized a lot, and I love that. But outside of your own, even YouTube resources, were there any other resources that you used, or ways in which resources were withheld and you felt like you were discriminated against?
Not really. I kind of turned to a lot of social support. There's been in my community, and even outside my community, there were Zoom meetings like this that were held for um, um, people that have been infected with COVID-19. It was just like listening sessions where you come in with other people from all over the country that have been affected by COVID-19, that have been infected. And we just talked, we shared our experiences, what were our challenges. People would talk about what they're currently facing. And then other people who have went past that stage would discuss how they were able to pull through. So I believe that also helped me a lot, because I was in between crossroads trying to marry what I'm seeing in these. There were several of these discussions, these virtual groups that we would discuss. Sometimes I would tell them what I'm facing, and straight up, someone would just come up with a solution. All right, someone would just tell me something that might not help 100%, but at least it's gonna provide some sort of support for the situation at that time. So I believe that helped me a lot. And I was, COVID, it was a new thing for me. I had never been infected with COVID-19. So I was just going online, anywhere I could get information. And there's, talking about online, there's a lot of people out there that they're just promoting these misconceptions about COVID-19, making you believe they're just telling you things that are not true about COVID-19. And I kind of like, I was scared actually from the kind of information I would get from all those sources. But I'm just happy that it didn't break me, it didn't destroy me. I was still able to come out of that. So I believe I got a lot of social support, both from my immediate community and from outside. We had participants from Texas, we had participants from Georgia, Kentucky, a lot of places where people would just come together and just talk about this, because at that time it was the most serious national issue. So everyone was talking about it, every media, every station, CNN, BBC. So it was kind of a global problem actually. So everybody, you got to be a dummy not to talk about COVID-19. So it was a serious problem and everybody was talking about it. Information about it was all over the place. Though some of them weren't right, weren't correct, but at least it was provided. So I believe those listening sessions, they really, really helped me a lot.
Thank you. Again, I appreciate you sharing. To kind of tie it with a bow, I was wondering what advice you would give to people who are worried about contracting COVID. Also, what would you say to those who are still in denial or disbelief about this condition?
All right, first of all, um, I believe at this point, everybody should be open to the idea of getting vaccinated, because right now that's the best bet for prevention of COVID-19. There's been a lot of misconception about vaccination. There's a lot of people out there that are saying, um, if you get vaccinated, there's just a lot of people just trying to scare people from this idea of vaccination. But I believe, the way I see it, at this point, we don't have a choice. All right, we don't really have a choice. We just have to, after you try your best to follow the precautions, to try to avoid, being in places where there's too many people crammed together like sardines in their cans, you just have to try and do whatever the health organizations have recommended, but because this is not just something that they brought out of thin air. It's something that was born out of months of research by qualified scientists and medical practitioners. So it's not something that the public should reject. I believe most people should accept vaccination, get vaccinated. It's not going to take anything from you. All right, it's not going to harm you in any way. It's for your own good. All right, the government is not benefiting anything from you getting vaccinated. The public is not benefiting anything from you getting vaccinated. It's for your own good. So I believe people should be open and available for vaccination. I think the government should even reinforce it. It should be necessary. Like, I think there was a period where it was kind of like a requirement, before you could attend some concerts, some meetings, and you would provide proof of vaccination. Like, I believe we should do that, because even as we speak, there are some people that have not been vaccinated. All right, so that's a problem. That's a problem. So I think if we combine this with our normal hand washing, sanitizing and everything that has been prescribed for against COVID, I believe we're going to be fine. The world has faced more serious problems than this. And I don't know. I believe it's the way God created the earth. The earth works as a self-supporting system. I don't think there's, apart from the end of the world, I don't think there's anything that's gonna destroy the world totally. All right, where it can succeed to bring the world to a standstill, but eventually life still continues. Life still goes on. I was COVID-19 positive, and now I'm here. I'm here talking to you. So it's proof that anything is possible. So we just have to do our best as humans to adapt to the world as it is.
Thank you.
Sorry,
That's all.
second question. I forgot about that.
Oh, go ahead. Yeah. It was about, what would you say to people who are still in disbelief that COVID-19 is a issue?
I think, quite frankly, please don't hold this against me. I believe it would be stupid for anyone to be in disbelief. All right. There's hundreds of millions of people have been infected by COVID-19, and tens of millions of people have died worldwide. So you can't tell me that you're seeing people die of something and you're still in disbelief. It's like being in disbelief about HIV. You cannot disbelieve HIV. It's there, it's killing people, it's happening. There are just some things that you can't just decide, maybe for cultural reasons. Some people, it's actually for religious reasons. All right, they just feel it's a propaganda, but I don't believe that. And I think no one should. All right, it's there, it's happening, and it has killed people. And so whatever it is anybody can do about it, whatever anybody can do to keep himself safe, to keep his family safe, I believe that person should just take the opportunity. COVID-19 is real, it's real.
Thank you, Mason. I'm all out of questions. Is there anything else you want to add that wasn't spoken about? Or just some general advice for people?
All right, on a personal note, I would like to say this. So far, I've really enjoyed our conversation. All right, I'm open to more opportunities like this because I feel there's a lot, not just COVID-19, all right? There's a lot about our society that we need to talk about. There's a lot that's happening that people are not talking about. There's a lot of actions that people are not taking. And it starts with this, people need to come together and start talking about certain things. For example, I'm disabled, all right? Now the people with disability, we face some kind of discrimination in our workplaces, in public, when we go for parties, when we go out to public places, and it's just something that happens. And because we're disabled, the world, the society doesn't talk about it, and it's really, really a problem. So I think there are so many topics. Some of these things I may not know that needs to be talked about. We need to speak up. So I feel that everybody needs to be more outspoken. If you're facing challenges, you need to talk about it. You need to talk to someone. You may never know what comes out from there. I was reading the newspaper the other day, and I saw a story about a guy who wanted to jump from the Brooklyn Bridge. And then an officer walked up to him, and they ended up speaking for about 90 minutes. All right. And then at the end of the day, the guy didn't commit suicide. He didn't jump off. And then 10 years later, the officer and the guy met at the same place. The guy had worked on his life. He's now a millionaire. And the officer was proud, like, all right, this is one life that would have been wasted. Within this 10-year period, I strongly believe this guy has changed the world in his own way. He has affected other people's lives. One or two people have been changed. They've been helped by being in contact with this guy. Now, these are things that would never have happened if that guy had jumped off that bridge. So you see what I'm trying to say? Like, we need to take action, not just in our finances, welfare, health. There's still other areas of life that we really need to talk about and see what we can do about it. So what I'm trying to say is, I'm open to opportunities like this to talk about not just COVID-19, about other topics and things that just relate to welfare, human welfare, and stuff like that. So I think I'll be right to say, whenever you get opportunities like this, you can just share it with me. You know, I would like to participate. I strongly believe it's not until you give somebody maybe money or a gift or something that you can help the person. All right. We could be in a group discussion like this, and then somebody just gets something that changes the whole game for him. So I believe lives can be affected in that sort of way. So thanks so much for having me. I'm really, really proud of this, and I'm happy I almost missed this meeting, but I just found a way to shuffle things I was doing, and I kind of met up with you. So thank you so much for this opportunity. I'm hoping I'll see you again some other time for something else.
Thank you. You definitely will. Hang tight real quick. We're going to stop recording and then we will move on.
All right.